Hi, I'm Andrea Blankenship, and I'm a breast cancer survivor. I was 41 when I was diagnosed with breast cancer. That's when I suggested I get a biopsy on both breasts, and then I was diagnosed with bilateral breast cancer. It was right in the middle of COVID. I had to do a lot of things by myself, and I think because there wasn't a lot of elective procedures going on, everything moved very fast. So I didn't really have a lot of time to sit and think about things and process anything. I was just going from appointment to scan to scan, and I was diagnosed on July 14th and had my mastectomy on August 3rd, so everything went very fast for me. No chemo, no radiation, but I've had 10 surgeries though. Reconstruction was not my friend. And then I also found out I had genetic testing done, so I had a different gene mutation that increased my chances of ovarian cancer. So almost exactly to the day, I had a hysterectomy as well. I had a lot of support from my family, from my second family at Route 18 CrossFit. They were great. They helped in any way that they could. In September of 22, the week we were moving into our new house that we just built, I woke up with an infection in my right breast, and I ended up in the hospital for 4 days on IV antibiotics, had to have an emergency surgery. My friends, family stepped up and helped us move. So yeah, they were great. I have a 13-year-old son, Jackson. He was 9 at the time I was diagnosed, so that was hard to talk to him about having cancer. He knew that my cousin had died from cancer a couple of years before I was diagnosed, so I think that made it harder. It's hard when you're first diagnosed. All these things go through your head, and like I said, mine was just a whirlwind. Use your support system. I'd like to thank, my family, all my friends, my Route 18 family, anyone that brought meals, helped us move, sent me little gifts in the mail, anything. It is very much appreciated. If I didn't say it, I thank you for everything that you've done and given us.
My name is Blake Michael, and my cancer that I had was rhabdomyosarcoma. I was 6 years old when I was diagnosed with cancer.
Looking back at the journey when we first found out that Blake had cancer, it started as just a ear infection, and the pediatrician put him on antibiotics, and the day after Thanksgiving, he woke up and he had lost all facial functions in the right side of his face. He was officially diagnosed 3 days later on November 29th with cancer.
How did you feel during that time? Frustrated?
Scared, probably.
His official diagnosis is stage 3 intermediate rhabdomyosarcoma, which is a soft tissue bone cancer. From there, he did, I think it was 148 rounds of chemo, and he did 6 weeks of radiation as well.
What was it for you during that time that gave you joy?
When they put the medicine in me, probably taking the long naps.
What gave you hope when you were going through treatment?
Just people, doctors, family, just everybody that did something for me that made me more healthier.
What goes through your mind when you go to those 4-month checkups?
I'm just always afraid that they're just gonna find something that we don't want to see in my brain, and then just never.
How do you deal with that fear? What gets you past that?
Just think of happy thoughts. Just think of what you love and not what you hate.
Tell me what you love. What do you think about?
Food, family, doctors,
Baseball.
baseball, I would also like to thank my mom for just skipping work just to come to my doctor's appointment. I just really thank the people who did that for me.
My name is Casey Blake. I am a survivor of acute promyelocytic leukemia. I woke up one day and I had a spot in my eye, and so my wife, Susan, is an eye doctor, and I told her about it. And so she took me to her office and looked at it and kind of started the ball rolling. We went and saw a retinal specialist that day, and he saw that I had some bruising, and so he ordered some blood work. I was in bed about 11 o'clock. I got a phone call from my primary care physician that I need to go to the emergency room. My leukemia, APL is really what people call it. The minute I got there, really, they started me on an oral medication. I just started right there. I ended up at the clinic for, I think, 18 or 19 days. Getting through the first couple days was hard. Like, I still get a little choked up talking about it. Talking to Susan, talking to my kids, talking to my dad, all that stuff was, my sister, my boss, just telling people it was, it took a lot. I learned a lot about, what life means, who you should care. Well, who do you want to spend time with? Who do you want to be around? And it puts a lot of things into perspective, just try to spend as much time with people that you can. The advice I would give, follow the protocol, follow the treatment plan. It's amazing to me how far we've come. And so I'd like to thank Dr. Wang, Zhenyi Wang. He's from China, and he's the person that cured my cancer. That's, I guess, first and foremost. My family, my sister, my dad, my other sister, my brother, my kids, all that. Really want to thank my wife. Yeah, without them, I wouldn't have been able to get through it.
Hi, my name's Jenny King, and I had colon cancer. I was 43 years old when I found out. So I went and got my colonoscopy, and sorry, I'm gonna cry. I was barely out. I was still kind of coming out of anesthesia, and the doctor came in and told me, we found polyps, we found hemorrhoids, but we also found a tumor, and it's definitely cancer. I was in the hospital for less than 24 hours. So I really do think it's because working out. I'm pretty regular about working out and lifting weights and staying in good shape. I don't know where this would have been if I didn't have those kind of healthy habits already established in my life. I remember one of the first things I said whenever I came out of the surgery, I was like, so when can I lift weights? And they're like, yeah, not anytime soon, And so that's just, that part of me, I think, is what's helped me in that recovery process. I leaned into friends a lot. I think I have a lot of positive friendships, and they were supportive no matter what. They're like, whatever you choose to do, whatever path you choose to go down, we're going to be supportive no matter what. We'll do whatever we can. So that took a lot of pressure off me to make a decision. You have to have hope. You have to have positivity. When you don't have hope, it is very hard for the body to heal. It is very hard to have a good outlook in life. And I do think hope can heal you. I'd love to thank my surgeon, Dr. Dawson. To be diagnosed with cancer And then all of a sudden you get probably one of the best surgeons to take it out. Like, that's God. I don't know what else it is. But I think she got it all out, so pretty happy about that. Yeah.
Hi, I am Michelle Phillips, and I am a breast cancer survivor. I was diagnosed at 51, May of 2023. I had the biopsy. I was diagnosed, I got the news like right before, the Friday before Memorial Day weekend, which was kind of a bad time because it was like 4 o'clock. I couldn't talk to my doctor, so it was kind of stressful. So I started with chemo. And then, so I did that for 5 months, 16 rounds of chemo. And then I had surgery. I did a single mastectomy. And then radiation after that. I did 25 rounds of radiation. Oh gosh, I had really great support. So my husband, I mean, he did everything. He was great. My mom, my brother, my sister-in-law. I had a lot of help, a lot of support. The football community at Highland. I mean, everybody kind of rallied around, which was really nice. I found joy in my friends, my family. Going up to chemo treatments, we'd go to lunch afterwards in Little Italy. That was fun. I mean, it just gave me something to look forward to. I think the best piece of advice I can possibly come up with is just try to keep moving. Try to get some exercise in your day, even if it's just, if all you can do is stand up off your chair, and do some calf raises or something. I really try to keep active and keep working out. There's so many people I'd like to thank, specifically my family. My husband, Ryan, is, they say in sickness and in health, but he's been a rock star. I don't say it enough. And my kids, I tried to shield them a little bit. I mean, they'd see everything, but I didn't want to tell them if I was feeling down or, but I hope, I thank them for being there for me. I thank all my friends. I thank my neighbors, who would bring me food. My football family, my friend Amy. I mean, just so many people around me, just, trying to keep me positive and in good spirits. And I have a friend in Michigan who sent me a card every week, and she put glitter in it or something. So every time I opened it, stuff would go everywhere. I'd get momentarily mad, but then I would laugh. So I'm so lucky, even in such a bad situation. I was very lucky to have just a tremendous support system, especially my husband and kids.
Hi, I'm Owen Ferris, and I had testicular cancer. I was 23 years old when I was diagnosed with cancer. I listen to this podcast every week called Part of My Take. They had an ex-professional baseball player on named John Kruk, played for the Philadelphia Phillies. And he was telling his story how he had testicular cancer, his stories of his recovery. And I was thinking, like, that would really suck if that happened to me. 2 weeks later, I was told I have cancer, not sports hernia. I was like, that's a good thing. I got checked out after I had the thing for probably about 8 months before I told anyone about it. From there, it was late October, first surgery in November. And then after that, I had my second surgery January 11th. No chemo radiation, just the first surgery to get the cancer removed. And then the second surgery was to get 28 lymph nodes removed from my stomach to hopefully stop the spread if there was anything spreading from there. I'm fully recovered now for a year and a half after my last surgery. I am about to turn 26 here on January 31st, and I'm all healthy. What gave me joy and hope throughout those recovery times was probably just friends and family coming to visit, my friends coming over. One actually worked for the Cleveland Browns, so he was able to get Wyatt Teller, one of the O-linemen for the Browns, to sign a jersey for me, which was really cool. And then my college roommates were able to get our college house painted and then printed out in a picture, and they framed it for me. So like, just those little things actually did a lot for my mental health. The advice I would give a current cancer patient is just take it one day at a time. Listen to your friends and family. They're there to help you. They're going to get you through those rough days. It might seem like it's never going to end, but it will. First, I would like to thank My parents, they were there every step of the way. My mom didn't tell me at the time, but was sleeping in the hotel right next to the hospital when I was each 6 days of my recovery. I didn't know about that until a couple months ago, actually. My dad always just being there, coming over, hanging out, doing everything he could. And second, I would like to thank my doctor, Dr. Haywood from the Cleveland Clinic. He was always very positive, very good. Never let me get down on myself. Always told me it's very curable. Like, you're gonna get through this. Like, don't worry. Like, we have the best doctors here to help you. So those are people I'd like to thank a lot.
My name is Tiffany Townsend, and I am a breast cancer survivor. I was 38 years old, and I just went in for my yearly checkup with my OBGYN, and she found a lump. So I went and had the biopsy, and it came back that it was stage 1, like triple positive breast cancer. So I started with surgery. So I elected to have a lumpectomy. So I had surgery about, I think it was about 2 weeks after that, maybe 3. And then from there, I did 12 weeks of chemo. Of intense chemo, and then I had a little break, and then I did 6 weeks of radiation. It was unbelievable. It was surreal, really. We told the kids after we knew what my treatment was going to be. My daughter, Olivia, so she's my oldest, she has special needs, pretty significant. She has Cri-du-Chat syndrome. It was harder to tell her because she wouldn't really understand. But then my sons, Gabriel and Matthew, we sat them down, and my husband was going to tell them, but he couldn't get the words out. So I told them and just told them that I'm going to be okay, but, you know, I have to go through this long treatment, but I'm going to be okay in the end. And my youngest son, he was 9 at the time, I think. Yeah. And he was just most concerned with, are you going to be bald? And I said, yeah. I said, but, you know, it'll be okay, and I'll wear hats and, you know, whatever. And when it came time, when I started losing my hair, the boys shaved my head, which I thought was really, really powerful. I found joy and hope in my family, the way that they just stepped up and supported me, even neighbors and friends from college that I hadn't heard from in a long time. That brought me a lot of joy and a lot of hope. I would like to say thank you first and foremost to my husband. He was and is my rock, and I don't know what I'd do without him. My kids for having patience when I maybe was tired and couldn't be the normal mom that I usually was. My mom and my sister were amazing. My friends, I have the most amazing friends, and they were always there to help me with whatever I need and keep my spirits up and support me.
I am Tim Belby, a rectal cancer survivor. I was 45 when I was diagnosed with rectal cancer. The guidelines were just dropped from 50 years old to 45 years old for your first colonoscopy. Went in and had the colonoscopy, not expecting them to find anything, and lo and behold, they found something. It was probably about 2 months from the time of diagnosis till we started treatment. Treatment, originally we went through radiation. Had radiation first, followed by some time off, and they did some scans to see how the tumor responded to the radiation. And then after that, went through a full course of chemotherapy, and that was the next step. I kind of thought I was through the woods and on the other side, and that was kind of a big setback, physically as well as emotionally and psychologically and all those things. So long story short, we ended up having the surgery, had a temporary ostomy bag, which was something that, you know, it was a big lifestyle change, as you can probably imagine. So had that for about 4 months, and then had the reconnection surgery and got rerouted and getting things going the way that God intended them to go. Who would I like to thank? I definitely my family, my wife, who has been by my side through the whole thing. My children, who, you know, it's tough on them as they're growing, you know, they're teenagers, and seeing their dad in that situation. They were fantastic through it all. Just so very grateful to my family for everything. Getting the word out there about the colorectal cancers in general and how they're affecting younger and younger people. Through my journey and being very open and vocal about what I've been through, I've had a number of people come up to me and say, hey, because of your story, I went and got my first colonoscopy. And you know, it's so good to hear that people are getting checked. I'm very proud of that fact of being, you know, kind of outspoken about the importance of early detection and going out and getting your colonoscopies. So get your colonoscopies, people.
Hi, I'm Troy McClary. I'm a survivor of head and neck cancer. I was diagnosed when I was 51 years old. I had found a lump on the left side of my neck. Just very small, didn't know what was going on, and went and got it checked. And then a couple months later, I found out that it was cancer and that I was going to have radiation and chemotherapy, and went through that, and everything went great. And then at the 2-year mark, I had another lump, and they removed most of the lymph nodes on the left side of my neck, and had radiation and chemo again, and proud to say that it's been about a year and I'm doing great. I had 6 weeks of radiation, and so I did that every morning and tried to keep my routine. I went to work every day, and probably the biggest mindset change was I went from feeling like I have to do things to I get to do things, and that was exciting. And again, the joy came a lot from just keeping a regular schedule. It was amazing not to let cancer define me. My wife Rachel and both boys are in their 20s now. For me, I never felt sick a day in having that. It was just the radiation, the chemo, and getting my head around the cancer, and just trying to be strong for them. But what I found out is they were incredibly stronger for me. So I would like to take a moment to say thank you to, of course, Rachel and my boys and my family. They've been amazing in this journey. All my friends and family, and again, many people that are watching this now, that just know how important you are to everybody. I've been sitting at the Ears to You fundraiser many years, and it's amazing the amount of people there that really make a difference every day for people like me, and it's just so appreciative. Thank you.